Good morning. This is Senate Health and Welfare Committee meeting of January 20th. Welcome, everyone. And today we're going to go over some bills that are in our committee. We're going to revisit S91 with our ledge council, and then we're going to go through S206 and then three bills related to mental health. We're going to cluster those together and see whether we want to put them together in any way or how we want to deal with those, because there are other mental health issues that may be included as we hear more testimony. More testimony. Before we get started, committee, I sent out a little email this morning regarding S273. It's a bill on gender identity and birth certificates. It came to our committee, and we can deal with the bill should you like to do that. But GovOps also deals with vital records, and they have some time and would be willing to work on the bill pretty quickly. So my suggestion is that I send the bill to them when we're on the floor today or tomorrow, and then allow for them to go ahead and work on it. So any thoughts there? I don't know if you saw the email. I did include the bill.
Are they favorable to working on the bill?
Oh, absolutely. Yeah, they truly want to work on the bill. And I also know that the House Human Services Committee is maybe working on the bill, and they're going to work that out, who starts what when, but it probably makes sense to take some of this off of our plate and allow for them to go forward with it. It doesn't seem controversial to me. And if we need to weigh in as time goes on, we can do that.
Sounds good.
So I'm not hearing or seeing any. Okay, we'll do that. I'll try and do that today. And Katie, good morning. Thank you for being here. We wanted to go through S91 again with some looking at considerations for possible markup. I did have a conversation with AHS, and they are working on providing testimony on the bill, and we'll pick that up next week. So this will be a chance for the committee to get a little bit firmer on what's there and what some of the questions that we might have might be. And I know that Senator Hardy has provided some her own comments in an amendment, and we can, as we go through the bill, Senator Hardy and Katie both, make sure we pick up on your suggestions. So, okay, thank you.
Morning.
Good morning.
Katie McLean, Office of Legislative Counsel. Let me pull up the draft for you.
Okay. And Aaron, have you posted the amendment that Senator Hardy put together or had?
I just did.
Okay, so if we refresh.
Yeah, it might take just a minute, but if you keep refreshing, it'll show up.
Okay, well, we'll begin. And Senator Hardy, you stop us along the way if we go beyond where your amendment is before it comes up.
Okay, and Katie, if you can help me, because the amendment is not a strike all amendment. So
Right.
Yeah.
Oh, okay.
Yeah.
Thank you.
So S91, this is the Parent-Child Center Network bill. And if you recall, where there's already a chapter in Title 33 that addresses parent-child centers, but this amends that chapter to create a network versus individual parent-child centers. And the first section is a definition section. So this is where one of the first changes would be. Later on in the bill, a term that's used is concrete supports, and that amendment would go right here. What I might suggest is, because I can't have both documents open in front of me at once with the screen share, is that I'll just flag where the amendments will be, and then after I kind of walk us through, I'll pull up the other document and show you what the amendments are. So anyway, there'd be a new subdivision 1 here that would be concrete supports. And then we have definitions of the parent-child center, a parent-child center, and then a definition of the parent-child center network. We could go into those in more detail, but I know this is your second walkthrough, so I'll try to keep it kind of a higher level. In subsection B, this talks about how a new parent-child center would become part of the network. And it basically says that every 6 years, the network could recommend to the Secretary of Human Services one or more new parent-child centers for designation as part of the network. And once this recommendation has been received by AHS, the secretary or the secretary's designee is to review that recommendation and to make sure that the proposed parent-child center meets the designation criteria that's set forth below in this bill. And that if the parent-child center that's been recommended meets all of the criteria as deemed, the secretary deems that those criteria have been met, then the designee becomes a designated parent-child center. So subsection C lists all of the criteria necessary to become a designated parent-child center. So some of these are already in existing law. I'll skip over those, but the new items would be complete a peer review every 3 years, which shall be conducted by the network, provide each of the 8 core services set forth in subsection D. So we'll look at that next. Indicate an intention to participate as a member of the network. And in subdivision 8, work to achieve population level quality of life outcomes relating to children and families.
Okay, I will have some questions here. I think one of my concerns is that, you know, we currently have parent-child centers distributed across the state. I know that I've got 3 in my district. We have a very high population, but is there any consideration in here for distribution of parent-child centers to ensure that a population that might not currently be served by the current parent-child centers be served with a new one? There's nothing. I'd just like to flag that as an interest. Senator Cummings.
Yeah, we're really setting up a gatekeeper here.
Yeah.
And along the lines of what you're saying, why 6 years? I mean, if we've got an underserved neighborhood, district in the kingdom, why do those kids have to wait 6 years to come in? We're taking power, I guess, that's been vested in the state, and we are now vesting it in a private organization, and that there could be issues there.
Yeah, so let's flag that, Senator Cummings. And, as the AHS comes in, they may also have suggestions in this area. Yeah. Okay. Senator Hardy.
I just wanted to add, this was one of the things that I had flagged last week, this 6 years, because it didn't quite make sense to me, and I had similar concerns to what both of you just suggested. I think AHS and the Parent-Child Center Network are discussing this and may have some suggestions when they come in next. I didn't put it in my amendment because I wasn't sure what they wanted, we're going to recommend. So
this is good. Thank you. Yeah, I've got a whole list of things as well. And I know that there's communication going on right now. So, which is why it'll be helpful to hear from AHS next week. So
right, I think AHS is actually sending the Parent-Child Center Network language today. So it's
yes,
just
they are. Yes, they are.
Timing wise, but yeah.
We don't see everything that happens, but we certainly know what's going on. So that's good. Okay. All right. Katie.
I'll keep going.
Yes, please.
Okay, so subsection D talks about those 8 core services that are referenced in subsection C, and it lists them all out. And so here's the list, this 1 through 8, and I'll just flag that this subdivision 6 is the concrete supports that Senator Hardy's amendment seeks to define, and we flagged where that update would go. And I will pull up the proposed definition after we have finished going through this bill as introduced.
Katie, I just want to, I can do it now or when we look at the definition, but the reason that there's a definition for concrete supports and not the other 8 is the other 8 seemed more self-explanatory, but concrete supports seemed like a term that taken out of context could mean something completely different.
Yeah, good catch.
And these, just to note, all 8 of these are defined in the grant agreement between AHS and the parent-child centers. So the definition that Katie put in the amendment is the definition that Donna Bailey suggested last week that is used in their grant agreements.
So, yes, and we did hear that in testimony. I don't know whether it was this year or in child protection oversight or last year or what, but it's there. So,
Yeah.
Good. Okay.
Okay, and then subsection E states that a parent-child center that was in existence on January 1, 2021 shall be deemed to meet the designation criteria of subsection C.
Okay, there may be some qualifications to that, but I don't know how the rest of you feel, but I think that my understanding is that this should go forward. I don't know a parent-child center that hasn't been highly effective. I've visited a lot of them, so, but any thoughts there at this point? We'll hold off to see what the AHS has to say around this one.
Okay, so the next section has to do with funding, and subsection A directs that the secretary is to annually disperse a joint appropriation to the network, which then distributes the funding to designated parent-child centers, and that any increases to base funding shall be based on increased community need, the provision of additional services, or the designation of a new parent-child center. Subsection B specifies that the
Okay,
network.
here's a question that I have. Does this in any way limit the type of appropriation? It looks like this is designed more for operational expenses. And it's a question, really. This is all base funding. Is there anything around capital improvement? I don't know. And do we need to be more explicit? That's all.
The appropriation language is there's base funding and one-time funding, and that is in the amendment. But I think that the grant agreements specify more detail about how the funding is used, because this wouldn't supersede having a grant agreement between AHS and the parent-child centers. That would
Right.
still exist, and so all
Right.
the details would be in that.
Right. So the question I have is really, last year, and probably again this year, we're looking at how some capital money was used, and we looked at where they've got IT work going on. And so I don't know whether we need to be more explicit at this level or not, but just raising that as a question. Go
We
ahead,
can ask
Kay.
AHS, I guess.
Yeah. Go ahead, Katie.
Okay. Subsection B specifies that the network is to work in partnership with the agency to develop appropriate measures of accountability and to provide any financial or programmatic information as may be necessary to allow the secretary to evaluate the services that are being provided through grant funds and the effect of the services on consumers and on accounting of the expenditure of the grant funds.
So this is where I think that we need to hear from AHS, and I know that within the area of Bright Futures, there is some accountability work that goes on with Head Start and others. So just the question regarding accountability and who's making those decisions, and do we need to reinvent the wheel? There already are perhaps some programs in place that are being evaluated. So again, look forward to having AHS in, but I wanted to raise the accountability piece as an issue. This puts the Parent-Child Center in partnership with AHS. It doesn't say anything else about how current programs are being evaluated or what the accountability measures are. So we'll just flag that one.
The next section has to do with the inflation factor, and this subsection is addressed in Senator Hardy's amendment. So I'll pull up the new language there in a second, but this whole subsection is removed and replaced. Same thing with the appropriation. This is addressed in Senator Hardy's amendment. So we'll take a look at that when I pull up the new document. And then, effective date is also addressed in Senator Hardy's amendment because, as you know, this bill was introduced in 2021, so we need to update that. So why don't I switch documents now? Okay, are we seeing draft 2.2?
Yes, we
Everybody
are.
can see it. Yep. Okay, great. So this is instances of amendment, and what I'll probably do, depending on how the committee would like to proceed with each of these, if it sounds like there are going to be a number of amendments, we sort of started with one amendment and it grew a little bit. So now I'm understanding that a strike all amendment would be more helpful to the committee. So depending on whether you want to move ahead and accept these or not, I can put together a strike all for you to see next time around.
We
So
could
first-
do that. Katie, let's go through it. We could do that. It's up to you what is going to be easiest, because I think we'll probably have other changes after AHS is in, but it might help for AHS to see where we are.
Yeah,
once
and
we
it
go
might be
through this.
helpful on the floor for members to be able to see the full strike all.
Yeah,
Since
we
there are
definitely
multiple
want to strike all,
instances.
no
Yeah.
question. Yeah.
Okay. So as we noted, the proposal is to add a new definition of concrete supports, which would mean community services and resources to address the immediate needs of the family or contribute to the long-term well-being of the family or both.
Okay. Senator Hardy, can you share with us where the definition came from?
Yeah, that was the definition that Donna Bailey, who's the co-president or chair or whatever of the Parent-Child Center Network, used in her testimony, and she indicated that it was the definition used in the grant agreement. So that's where that came from.
Good. I think, and thank you, because if we just put concrete supports in and then a negotiated grant changes it, it could be something completely different. So this really solidifies it, makes it concrete.
It makes it concrete.
Sorry,
Yeah.
I couldn't resist. All right. Okay.
Okay, the second instance of amendment, this is the inflation factor piece. So the lead-in language basically says that we're removing the existing subsection C and putting in this new subsection C. And that would read, in determining the annual appropriation for the Parent-Child Center Network, the Secretary shall employ an annual inflation factor using the Employment Cost Index for total compensation for private industry workers in New England, as published by the U.S. Bureau of Labor Statistics for the 12-month period ending in September of the most recent calendar year.
So the question, go ahead, Senator Hardy.
Okay, I was just going to explain where this came from,
that's fine.
and then happy to answer questions. So the previous language was pretty vague. It said something like the secretary should use an inflation factor that was reasonable and based on economic conditions. And so this inflation factor Nolan and I did some research on inflation factors that might be the most reasonable. The ECI, or the Employment Cost Index, it's done by the US Bureau of Labor Statistics. It's similar to the CPI, the Consumer
Right.
Price Index, but it's more based on salaries and
Workers.
wages, which are the driving cost factors for social service agencies, healthcare, education, all the things that are done by the Parent-Child Center, because it's so driven by employment. So this is this is based on the New England one, so it's the regional one for New England. The reason the 12-month and September is in is because that's when this statistic comes out. It's a September over September statistic. And I'm happy to send you all the most recent chart so you can see it. But after discussion back and forth, Nolan and I agreed that this one was probably the most reasonable, but I don't want to speak for him. So if he wants
All
to.
right, well, we're going to get to Nolan. He has a fiscal note for
Yeah.
us. And Senator Cummings,
Yeah, I'm unmuted. Wearing my fiscal chair mosquito at the picnic hat. This is opening a Pandora's box, and it's going to cause appropriations to shudder. This is pretty much telling them they have a built-in inflation factor. If we'd done that for mental health workers or anybody else, is the Parent-Child Center going to, when we're down to 0.8% growth in 2 years, are the Parent-Child Centers going to get a 3% increase and then everybody else swallows it? So this one just is a red flag. I know they'd love it. Everybody would love it, but it's a red flag.
yeah, thank you, Senator Cummings.
I love being a money chair.
The original
let-
bill had the inflation factor language, and this one seemed to be more specific. That's why
Yeah.
We get it. Yes, and you've worked hard on that and brought something that might be useful. I know that when we worked on the CPI language for minimum wage way back 100 years ago, in 2002, I think it was, and then updated it. See, that was a heavy lift. So putting this in, I share Senator Cummings' concern overall. I think it's important that we pay attention to the needs for our DAs, our SSAs, our parent-child centers, all the folks who are doing so much good social service work for us. But if we do it for one, we should do it for all. And I'm thinking that maybe there's a recommendation here that we can make as we go through the budget process. So keep that in mind. Who would like to include this at this point? We won't say we don't want it at all, but who would like to include this in the bill at this time?
Jenny, could we say should consider
Yeah,
rather?
You could also just say that change the shall to a may.
sure.
Yeah.
That makes a lot of sense. And I think it's helpful. And I also think that as we're going forward with our full budget recommendations, that we may want to add this into our letter for more than parent-child centers. There's a whole workforce out there,
Yeah.
child care centers generally, as well as mental health and others. So
yeah, I think that, I mean, I definitely appreciate Senator Cummings' point for sure. And also Senator Lyons, your point that if we're going to do it for one, we should do it for all. And I think that that's one of the reasons our DAs and SSAs are in such a bind right now, is there hasn't been an inflation factor that keeps up with the cost of employment. And this
Yes.
is the one that seems to be the most relevant for these types of agencies. So if we are going to do a blanket recommendation, I mean, I can let Nolan speak too about it, but this is the one that, as he and I looked at the charts, seemed to be the most relevant for these types of organizations.
Yes. That's,
Just-
this has been very helpful. Nolan, can we get the chart and send it to Aaron? We'll put it up on our webpage. Yes, Senator Cummings?
The governor's proposed a tax credit for
Yes.
childcare workers.
Yes.
Can I assume that that includes the people that work at the the family centers?
Parent-child centers, we don't
Okay.
know. I don't know the
Good
extent.
I don't know if that's what's going to go through either, but I would assume that they would be included in the governor's proposal.
Well, when we get to that, we will analyze that. But you're right, it's a good question.
And if I may too, to follow up on Senator Hardy, and I'll send the charts, but the ECI rate for this particular one for September 2020 was 2.2%. In September 21, the most recent, it was 3.9%. So, but if you compare that to CPI was almost 7%. So just to give you some context of why one of the things driving Senator Hardy's thought on this.
Yes,
Well, I
Thank
can't
you.
speak to her
Yeah,
mind
but-
either.
yeah.
You're not getting 8% increase.
Yeah, I mean, I think this one was the reason, and that's a really good point. We know that there's been a lot of inflation over the last year, and that's driven CPI. Wages have been less, have been more stagnant, but have still risen, but just not as much. But they're the driving factor for these organizations, including schools and universities, because everybody knows payroll is more than 80% of their costs in general. So that's the most relevant, rather than, how many toaster ovens. I don't know why I said toaster ovens. That was the first thing that came to my head.
Maybe you need a toaster oven, Senator.
Maybe I
Rice
do.
cookers.
Yeah, rice
cookers,
cooker.
There you go.
Yes, and a few years ago, we worked on providing some increased reimbursement for our mental health workers at Howard Center and others. And that went through, but that was one time. We want to keep our foot on the gas, so to speak. So this may just be the language we need. So Katie, it looks like if we change the word shall to may, the committee would be supportive of having this included in this bill. And then I am looking to include this also as we go forward with our budget recommendations on our other social service folks and childcare folks. I think it's a good start. Thank you, Ruth, for doing that.
Sure.
So
And
just
then
to
you-
jump in, did you decide if you're just changing it to a may instead of a shall, or how did you?
Yes, we
where'd you
just
come down?
said, yes, Nolan, just ask Katie to please change the shall to may, and then we'll include it in our amendment.
We could do should, which is stronger than may.
Now
But
you're getting
really-
pushy.
Really
Okay,
might.
I'm ready for should.
I like
Let's leave it.
should too.
Let's leave it at may. We've got both extremes. We've got shall and may, and then when we come back to it, we'll decide on should.
Okay.
All right.
Okay, so that brings us to the third instance of amendment, and that is replacing the current appropriation section in the bill with this new language. In fiscal year 2023, 1.5 million, a 1.5 million appropriation shall be added to the existing base of 3.35 million for a total base of 4.85 million to be appropriated to AHS for distribution to the network. In addition, in fiscal year 2023, 3.7 million and one-time funding is appropriated to AHS for distribution to the network.
Okay. Okay, that's the one-time funding that you mentioned earlier. Good. And
Yeah,
that's
and this-
that's for IT. I think that was the I'm trying to remember. I think it was what was needed in the next steps. But could
I
be
don't
wrong.
think so. I
Or
think
was
that
it
for
capital?
childcare. I think this is really just emergency program support because of COVID, is my understanding. But we can ask the Parent
Yeah.
Child Network.
Yeah,
this
no, I
will-
do remember the number. I just didn't remember the filling in the blanks.
Yeah, I
Okay,
think it's for a whole bunch of different things depending on the individual parent-child center. But this is their request and it will undoubtedly get pulled out by appropriations, but just, wanted to be clear about what the numbers were because it was an old bill.
yeah, good, thank you. So, any let's leave, do you want to put this in committee? I think let's hold it in. Put it in for now. We always are going to hear from AHS. We're also going to be looking at some budgetary considerations, and the bill obviously will be going to appropriations, but we can hold this as our recommendation at this point. Okay,
Sounds good.
good. Senator Hardy, you don't count. You can't because you put it there. I'm
Oh,
kidding.
okay, sorry.
I'm kidding. No,
No, I
thank
get
you.
2 votes because I put it there.
You got 2 votes. Katie, so we're including all of this
Got
with
it.
that one change, right?
Yep, I've got it. And so
And
then the
then-
last change is just updating the effective date from
Oh.
2021 to 2022. So that's pretty straightforward. So I've heard that it sounds like I'll be coming back to you with the strike all amendment, and I'll include all 4 of these amendments in that for the committee to continue reviewing.
Thank you. And then we'll hear from AHS, and I'm sure there'll be a robust discussion after that. We'll go through the bill one more time and make any further amendments. We're going to hear probably again, hopefully anything that AHS is bringing us will have been discussed and worked out in some way with parent-child centers, but we may have to negotiate a little bit between those two. We'll see what happens. All right. So Nolan, are you,
So,
can you provide us with a fiscal note on this?
yeah, so for the record, Nolan Langwell, Joint Fiscal Office, I should have said that earlier. So there isn't a fiscal note yet, only because you are crafting a bill still. I can't do a fiscal note for the bill until you've crafted it. Now, that said, I think you've given me enough to be able to write a fiscal note. What I can tell you is that based on the numbers, if you have a 3.35 base currently, and you increase the base to by 1.5, then you're looking at 4.85 for fiscal year 23. And then you have a one-time of 3.7. So if you're looking at what the increase for this particular year is, if you take the 1.5 and the 3.7, it's a $5.2 million increase. The other thing to keep in mind too is that if you increase the base, right? So the total new base is 4.85. That's the 3.3 plus the 1.5. That's 4.85 new base. And then if you apply the inflation factor of, let's say we use the current one, 3.9%, then in fiscal year 24, you're at 5 million. Just to give you a sense of all
Right.
the pieces. I'm going to put this on paper so that it's kind of a Venn diagram, but I'll
We
put this on
got it.
paper so you can see it and you'll be like, okay.
Yeah, no, that would be good. And I know that the bill isn't finished yet, but this is helpful at this stage. So if you can put something on paper, and then as we modify the bill,
Yeah.
you'll be modifying that as well. Thank you. Senator Hardy.
I didn't hear all that you said. Sorry, Nolan. I was looking at something else, but once you put it on paper, the 3.7 is meant to be one time. So that shouldn't be included as a part of the increase for next time.
Yeah, it's not. It's not.
No, it's
Okay.
not. He was talking about the
It's
base.
5.2 increase this year total. So if you have it all together, it's 8.55 total. And it's 3.3 current and then 5.2 increase, which is the one-time ending base increase. But then I was saying if you take the 3.3 base and you increase it by 1.5, now you're at 4.85 base.
Yeah,
And
but
then-
last year they got a one-time of 3.7 as well. So you have to include that as last year's one-time and last year's amount. So you're inflating the increase more than you should be.
You're at, why don't we have this offline then?
Okay.
Yeah, Nolan, why don't you go through it, and Senator Hardy, you can weigh in as needed, but we're not at the end yet, but I do see some one-time, and I also see some ongoing within the appropriation that's listed. And we'll have to
I'll throw
sort that
together
out.
something and I'll send
Yeah.
it to Senator Hardy, and then we'll just to
Yeah.
see,
Okay.
make sure they're on the same page. I know
Yeah.
that she's a recovering fiscal analyst, so.
I am, sorry.
Oh, no. That's a good thing. Okay. Committee, any other comments to be made regarding either the appropriations pieces, the wage increase piece, or the all the other sections of the bill? I think we've asked some questions through the bill, and we can come back to it next week. I think I have it on the agenda. Aaron, you can correct me if I'm wrong. We'll get AHS in for some testimony. Senator Hooker.
Thank you. Is the one-time funding expected to come from ARPA money, from federal money?
You know, I was thinking the same thing, and that would be a discussion in appropriations, but we certainly could advocate for that.
Okay.
And I think, you know, as we did last year, we had ARPA. I don't know what the full bucket is on ARPA funds available for human services, but we certainly can ask to make that happen. And Senator Cummings, you're on joint fiscal. Do you have a sense of? No, okay.
No, I thought everything had been committed last year, but there's a lot of churn.
Mhm.
So I don't know at this point.
Yeah, I was getting that message as well. So, but good question, Senator Hooker, and we'll keep that one in mind as we go forward with any of our recommendations. Okay. So we're good on S91. Thank you, Nolan, and thank you, Katie, on that one. So we will take a step forward, and now Aaron, is Senator Brock, are you notifying him to come in?
I just did. He'll be here soon.
All right, let's just take a little breath and wait for Senator Brock to come in to present his bill, and then Katie will walk us through S206.
You want me to take the live